How can I help someone with bipolar disorder?
Helping someone with bipolar disorder can be a challenge. The person's moods will be unpredictable, and it can be difficult to know how to react or cope. But if you make the effort, you can make an enormous difference in the life of your friend or loved one. Knowing they can rely on you can help them stick with their treatment plan and stay more positive. It can also be rewarding for you to know that you're helping your friend or loved one cope with the ups and downs of life with bipolar disorder. 1. Educate yourself. The more you know about bipolar disorder, the more you'll be able to help. For instance, understanding the symptoms of manic and depressive episodes can help you react appropriately during severe mood changes.
2. Listen. You don't always need to provide answers or advice to be helpful. In fact, simply being a good listener is one of the best things you can do for someone with bipolar disorder, especially when they want to talk to you about the challenges they're facing. Offering your acceptance and understanding can go a long way in helping that person feel more comfortable with their condition. You can become a better listener by 1. Actively paying attention to what they're saying. 2. Staying calm during conversations. 3. Avoiding arguments. 4. Avoiding any topics that seem to irritate or frustrate them.
3. Be a champion. For people with bipolar disorder, it can sometimes feel like the whole world is against them. Assuring the person that you're on their side can help them feel more stable. You don't have to agree with the person's behaviors and actions, but telling them that you'll always have their back can be very beneficial. People with bipolar disorder often feel worthless or hopeless, so affirming their strengths and positive qualities can help them recover from their depressive episodes more easily.
4. Be active in their treatment. Treatment for people with bipolar disorder usually consists of many therapy sessions and doctor visits. While you shouldn't necessarily attend these appointments, you can help someone with bipolar disorder by coming with them and then waiting for them until their appointment is over. These appointments can sometimes seem complicated or scary to people with bipolar disorder. Having someone there who can offer support and talk to them may help reduce any stress or anxiety they may be feeling.
5. Make a plan. Bipolar disorder can be unpredictable. It's important to have an emergency plan in place if you need to use it during severe mood episodes. This plan should include what to do if the person feels suicidal during a depressive episode, or if the person gets out of control during a manic episode. You should also have everyday plans that can help the person get through the time between extreme episodes. These plans can include coping mechanisms, such as what the person can do when they feel a mood swing coming on, or how to complete chores or other daily activities when they have low energy levels. Make these plans when the person is in a calm and stable state of mind. It's best to write them down so both of you can easily refer back to them. Sometimes people with bipolar disorder can become quite impulsive when they're in the manic phase of their illness. When your loved one is well, they may ask you to hold cash or credit cards for them, which will minimize the potential financial damage they can do to themselves while in a manic phase. If you agree to do this, be prepared to be on the receiving end of some hostility when your loved one demands that you give them their credit cards, bank books, or cash. Think in advance about whether you can deal with this before agreeing to support your loved one in this way. 6. Support, don't push. Your support can be very helpful to a person with bipolar disorder. However, you need to know when to step back and let a medical or mental health professional intervene. While people with bipolar disorder are capable of making conscious decisions, you need to understand when their moods and behaviors are out of their control. Also, don't take it personally if the person experiences a setback while you're trying to help. Remember that you're both doing your best.
7. Be understanding. It can be hard for people with mental disorders to understand what they're experiencing. Those with bipolar disorder may not know why their moods are shifting. Trying to understand what the person is going through and offering your support can make a big difference in how they feel.
8. Don't neglect yourself. While you're caring for someone with bipolar disorder, it can be easy to forget to care for yourself. But before you help someone, you need to make sure you have the time and emotional capability to do so. If you do decide to help someone, make sure you're getting enough sleep, eating properly, and exercising regularly. Keeping yourself healthy can better allow you to keep the person you're helping healthy.
9. Be patient and stay optimistic. Bipolar disorder is a long-term condition, so the symptoms will come and go throughout a person's life. The disorder is unpredictable, with symptom-free periods alternating with extreme mood episodes. For the sake of the person with bipolar disorder, try to stay patient and optimistic. This can help them stay on track to living a full, healthy life.
10. Know when it's too much. No one knows how to handle bipolar disorder better than the specialists trained to treat it. If you're helping a person with bipolar disorder and it feels like things are getting too difficult to handle, reach out to a medical or mental health expert right away. Call 10111 if the person becomes abusive, or 0800 567 567 if the person threatens to harm themselves.